Imagine walking into a surgeon's office with almost zero hip pain, only to be told you need to have double hip replacement surgery. That is exactly what just happened to one of my students, and it exposes a massive flaw in how we approach hip pain today. If you didn't see my previous video on Allison, she's a 54-year-old endurance athlete. She was told she has bone-on-bone arthritis and hip impingement or FAI bone shapes, and that she was just going to have to learn to live with hip pain and expect surgery in the future. She had 9 out of 10 hip pain, but with the help of my Healthy Hips program, got it down to 0.5 out of 10 in only 10 weeks. And then she went on a 3-week trekking trip in New Zealand. No big deal. Well, she just posted an update on her hip pain saga, and it's kind of mind-blowing, so I felt like I had to share it. After all the success she had, she decided to go to her hip surgery consultation anyway, just out of curiosity. And what happened next is a perfect example of why so many people get stuck in chronic hip pain. And the doctor looks at her x-rays. He tells her, you need double hip replacement. Both hips are bad. Think about that. She's close to zero pain and the doctor is saying, this looks terrible. We need to cut off the ends of your femurs and replace them with metal. Allison even tells the surgeon, hey, I've been doing exercises and I've gotten my hip pain almost to zero. He told her, pain is subjective. Then he said, and I'm quoting from Allison's story, whether it is this month, next month, or in 6 months, hip replacement is where you will end up. The only thing that mattered to him was what was on the x-rays. To him, that's the only objective truth. But here's the part that the surgeon couldn't explain. Allison has FAI and osteoarthritis in both hips, but only one hip hurts. If the bone-on-bone is the cause of hip pain, why did only one hip ever hurt? The surgeon had no answer because the only thing he's looking at is the bones. And if you are only looking at the bones, you're ignoring the muscles. And muscles are where you have the most leverage to improve the quality of your life and the comfort of your body. You influence muscles clearly and directly, and you can do it cheaply and safely with exercise. Now let's be real for a second. Is exercise going to be a 100% effective cure for everybody in every situation? No. But here's the thing, there is virtually no downside to trying exercise when you have chronic joint pain. Of course, you take things slow and easily and patiently coax more function out of your body. You do not immediately start doing high-intensity interval training or doing Olympic barbell lifts. You remember that slow is safe and fast is foolish, and you gradually improve your body, pay close attention, and learn what it needs and what it responds well to. At worst, you might tweak some things and get frustrated with the process and feel like you just didn't get that far. But at best, you're like Allison canceling a surgery you apparently didn't need. And even if you do eventually decide that surgery is the right answer for you, I've had countless students tell me that they were glad they tried exercise first because it helped settle their minds and also prepared their bodies for the recovery process after surgery. They went into the operating room stronger and more flexible and with a deeper understanding of how their body works. So when it was time to recover after the surgery, they had a big head start. The key takeaway here is to ATM, always think muscles. There are plenty of people out there focused on your bones, but if you want to take control of how your body moves and feels, you need to be thinking about your muscles. And as part of her update, Allison shared another interesting tidbit in the same vein. She met a 72-year-old man who lives in her building doing knee exercises, and he told her that his whole body is riddled with arthritis, but the way he manages it, all with exercise. And another comment to drive this point home is from Mary, who was responding to Allison's first video. Mary is 59 and started getting hip pain after a pool injury and starting a desk job a few years ago. Over the last couple years, her hip pain got pretty bad. Now, she writes, when I saw my doctor last week, my x-ray showed bone on bone with osteoarthritis, and the doctor recommended both hips replaced. He had no explanation why, like you, my right hip pain was down to a 1 out of 10 just with me cleaning up my diet and starting some glute exercises. After researching and following Matt, I believe I can get back to my old self without surgery. Everyone thinks I'm ridiculous and tells me to just have surgery. I purchased the Healthy Hips program and will be starting tomorrow. Thank you again. Mary, thank you. Allison, thank you. You're both reminding us to ATM, always think muscles. If you're ready to start your own journey rebuilding your hips, go to uprighthealth.com/HH or use the link that's down below. Share your story down in the comments section. Watch Allison's first video right here. Subscribe, and as always, I hope you remember that pain sucks. Life shouldn't.